I'm Jennifer Wolf, a professor of health policy and management, joined by Judith Vick, an internal medicine resident, and we're both from Johns Hopkins University. We're honored to be a part of this important AHRQ initiative. Our contribution involves a mixed methods review of engagement as it relates to persons and families managing multiple chronic conditions. Next slide. So there's been a profound movement in care delivery towards recognizing the essential role of individuals as protagonists of their care. However, a wide range of terms have been used to describe the individual patient role in this movement. A 2014 bibliometric analysis by Menichetti and colleagues tracks the evolution of terms in interactions with clinicians in a dyadic context, and finally, towards a model of individuals being activated and engaged in co-producing their health in partnership with clinicians within organizational systems of care delivery and policy. Our paper adopted the definition of engagement, which is listed on the slide. Key features include a focus on behaviors of a range of actors that include but extend beyond individuals to their family members, to health professionals, as well as organizations, with a focus on active and collaborative partnerships in the co-production of health. In our review, we identified 6 conceptual models of engagement, all of which have been published in the last decade, reflecting the recency of interest in engagement. Each of the models that we identified describe factors that promote and support engagement across individuals, organizations, and systems, but we found wide variability in the underlying definitions of engagement, core elements, the levels across which it transpires, and the emphasis on special populations, circumstances, and outcomes. None of the models specifically considered individuals with multiple chronic conditions, and nearly all did not consider family engagement as distinct from that of patients. Finally, we wanted to note that engagement is not universally viewed as a panacea. Robert Neese and colleagues noted in a 2013 paper the disconnect between human intention and behavior. They instead suggest there should be attention to choice architecture and the promotion of decision environments that are purposely designed to encourage better behavior, such as the use of defaults, active choice, and pre-commitment strategies. And they suggest that fostering such environments may be a more useful strategy than engagement strategies alone.
We next undertook a scoping review of reviews that addressed engagement in the context of multiple chronic conditions. With the assistance of an informationist, we ultimately identified 6 reviews. Just one review explicitly addressed interventions related to engagement among individuals with multiple chronic conditions. 4 reviews addressed self-management among those with multiple chronic conditions. And 1 review, a systematic review on involvement in decision-making among persons with multiple chronic conditions, had as its objective to assess the relationship between interventions and outcomes of interest. The 1 review that specifically named engagement as its object of study was a scoping review of patient and family engagement interventions for adults with multiple chronic conditions that was published at the beginning of 2020 by Obina Daniel and colleagues. The review identified 21 studies of engagement interventions for persons with multiple chronic conditions, the vast majority of which focused on the direct level care of engagement. Over half of the interventions were classified as being in the information and activation category, falling short of the fullest expression of engagement, the information, activation, and collaboration category. The components of engagement interventions in this paper fell into 4 buckets: technology, personnel, preparation for visits, and practice level changes. The 4 reviews of self-managed strategies describe challenges including psychological distress and emotional impact of multiple diagnoses, perceived capacity or beliefs about self-efficacy, lack of coordination of care, and receiving contradictory information from various health professionals. The 1 review that aimed to assess the relationship between interventions and outcomes was this systematic review, which identified 3 interventions regarding involving adults with multimorbidity in decision-making and found little high-quality evidence to support a causal relationship between interventions and outcomes. On the whole, our mixed methods review identified wide heterogeneity in conceptualizations of engagement, interventions, and outcomes. This heterogeneity limits synthesis and comparison. We identified 3 promising areas for future work. The first is the goals of engagement and outcomes that matter most for persons with multiple chronic conditions. The heterogeneity of models, interventions, and outcomes suggests the need for clarification of the ultimate goals of engagement for those with multiple chronic conditions. How can we best ensure that study goals and outcomes align with the goals and desired outcomes of persons with multiple chronic conditions? And how do we measure these goals and outcomes in a way that allows comparison among different interventions and studies? A second promising area for future work in the field considers infrastructure such as choice architecture, physical environments, models of care, and communication technologies. How do system level and community level structural interventions relate to engagement in direct care for those with multiple chronic conditions? How do system and community level factors interfere with or support engagement? And how do we design a system that makes it easy? And lastly, although some proponents of engagement identify intrinsic value in engagement, there are potentially harmful sequelae. In this vein, we ask, what safeguards need to be put in place to ensure that a focus on engagement doesn't unintentionally further marginalize vulnerable populations, including those with multiple chronic conditions? And how do we engage vulnerable or hard to engage populations in research about engagement and to guide implementation of engagement interventions? Thank you so much for having us again, and we look forward to talking further on November 17th and 18th.